I'm Madison Mills. This is Bloomberg Quick Take. In the early days of the pandemic, we thought that children were pretty safe. But now COVID-19 cases affecting young kids are higher than ever. That's due to the surge of the Omicron variant. Now, New York City alone has seen a significant uptick in pediatric hospitalizations as children under 5 are still not approved to get vaccinated. With us now to talk about what she's seen in pediatric cases is Dr. Susanna Hills. She's a pediatric airway surgeon at Columbia University Medical Center. Dr. Hills, welcome back to Quick Take. Just walk me through what you're seeing on the ground in terms of kids and COVID cases, especially as we see this surge due to Omicron.
Yeah, it's really been incredible that so many kids are now being affected by this virus. We felt relatively reassured that kids were safe. We're learning with this Omicron variant that kids are not. They're ending up in the hospital with this virus. And in particular, here in New York City, there's been a fourfold increase in our cases in the hospital with children in the last 3 weeks statewide. So we're really seeing a huge increase in the number of kids who are ending up in the emergency room. And that's on top of kids who are already coming in for other things like RSV, other viruses. And it's really something that is causing all of our hospitals across the city and the state to consider cutting back on elective surgeries to decrease our volumes of other kinds of cases in the hospital in order to create room and space for these kids who need our help right now.
What is it about Omicron that's causing this surge in hospitalizations among kids?
Yeah, well, first of all, we know, Madison, that this variant is more transmissible for sure. It's clearly equally as transmissible among kids as it is among adults. And the population that is ending up in the hospital are those who are unvaccinated. That is disproportionately our pediatric population because fewer of those people who are in the pediatric age range are vaccinated. Right now in New York, for example, in the age group of kids who are 5 to 11, none of the kids who are in the hospital are vaccinated in that age group. And in the older set of kids, 12 and up, about 75% of them are unvaccinated. So we're seeing that the vaccination status is a huge factor.
So what can we do to get these kids vaccinated? What's the timeline on that?
Yeah. So as we know right now, kids 5 and up are eligible to get a vaccine. And really, we're urging all families to get their kids vaccinated if they have not already done so. In addition, the kids who are 16 and up are eligible for a booster. They should go out and get a booster as soon as they're eligible because that is what is keeping patients out of the hospital. Unfortunately, for the younger group, it looks like we won't have vaccines available for kids under 5 until 2022. Pfizer's estimating the second quarter of 2022. Moderna is looking at its data as well, along with Pfizer, gathering the data to submit for authorization. They may be available slightly earlier, but we'll have to just wait and see. In the meantime, everybody around that younger group that can't get vaccinated should go out and get a vaccine to help protect not only themselves, but all of those people who cannot yet get vaccinated.
Right, doctor, that was my next question for you. I mean, a lot of people, even some of the health experts that we've had on this show have kind of said, look, with Omicron, it's just proof that this pandemic is going to be around and we kind of just have to live with it. But then you think about these kids that you're talking about who are hospitalized, and it just doesn't feel like you can throw your hands up and let this continue to happen. What can people do? What can the young adults who watch our show do to curb the spread of the virus? I mean, if you're not interacting with kids, do you have to change your behavior still?
Yeah, this has to be taken incredibly seriously right now. We're in a time period where we're going to be experiencing a surge in the next few weeks because of all the gatherings that have been happening. All of those indoor activities among people where vaccination status is unknown. We're seeing it here in our clinics and our hospitals every day. People infected with COVID, families infected with COVID, and they didn't even know that they were spreading it. And a person who is in their 20s, 30s, 40s, any age group is incredibly capable of spreading this to a younger person, a child who might struggle with this virus and end up in the hospital. So it's really important to do those things, especially now at the peak of this virus, like masking, hand washing, avoiding indoor gatherings, especially with New Year's coming up really, I urge everybody to be very careful about the vaccination status of the people around them. And for everybody who's not vaccinated to just go out and get protected so that they're not spreading it to somebody else who might be vulnerable.
You mentioned the surge that we're going to see in the next few weeks, but I do think about South Africa and what we're seeing there. Luckily, a bit of a drop off in cases. We're seeing that the positivity rate there is at 61% of the previous peak from mid-December. So that is an encouraging sign. Does that give you hope that we're going to see an improvement in the hospitalization status of children here in the States?
Yeah, I would expect that we will absolutely see an improvement, that the surge will eventually fade back down to a more, reasonable lower level of disease. It's not going to go away, but we can expect the surge to come back down. But that is after all of these high risk activities have occurred, and that includes New Year's. We're not done with the holiday season. That includes New Year's. People are going to be together, gathering, spreading the infection, then getting sick, and then a week, 5 days, 10 days later, that's when they end up sick in the hospital. So we're going to be seeing the surge coming in January, in early to mid-January, and it'll just depend how long that lingers on how well we're able to, again, recover from that, and how many people are going to get vaccinated and wear masks and do the protective things they need to do in the coming month to 2 months.
Yeah.
But yes, I would anticipate if we do the right things that this surge will fade, yes.
And I want to talk to you about your own backyard here in New York. Schools, of course, returning January 3rd, and it's the largest school district in the country, announcing new rules today regarding isolation for students who do come into contact with the virus. If they are asymptomatic and test negative, they're not going to have to isolate, and they're also going to double down on testing. Do you think that's enough to keep our kids safe in school?
I think we're trying to sort of move along and be flexible with the information as we receive it and as we learn more, and these variants behave differently. So there are a lot of different strategies that have been tried, from quarantines to closing classrooms to test and return to the classroom. And there's some pretty good data from California and also from Illinois that the test and stay in school strategy can work and be really effective. The key, though, to making that work is having tests available, making sure tests are done in a timely fashion, and continuing to do all of the things that prevent the spread of the virus in case someone tests negative and turns out to then be positive, like masking, like maintaining some distance, having good ventilation, and hand washing. Those are all part of this strategy, because you can have a negative test that can then show up positive a few days later.
I want to end where we started, on the situation for the kids who unfortunately are in the hospital. Can you tell me what their status is sort of looking like as a whole? Are they able to get out of the hospital quickly because of their youth? Are they having less severe symptoms, even though it's enough to put them in the hospital? What does that look like?
Yeah, I mean, in my experience with the patients that I've seen anyway, who have had COVID-19 in our children's hospital, it's generally the kids who have underlying conditions that end up being the sickest. Those with underlying airway problems, underlying cardiac problems, immunosuppression, they're the ones that struggle the most with getting out of the hospital, that might be more susceptible to systemic inflammatory disease that can cause organ damage. Kids who get COVID and test positive that I see in the outpatient setting, who are otherwise healthy, generally do very well and are much less likely to end up in the hospital. But again, we definitely are having children end up in the hospital for a day, a couple days, who are unvaccinated, who are vulnerable, and who end up, just struggling with the virus and needing help.
Really important reminders there in great context, Doctor. Thank you so much for joining us this afternoon. We really appreciate it. We're going to have more Quick Take for you right here ahead. For now, I'm Madison Mills in New York.